I'm going to turn it over to Pat, who has been an active member of this great church, which has been such a large part of this community. And this church helped create such a from home. Since welcome to the only African American church in the city of El Cerrito. Okay, we are the founder of a lot that goes on in El Cerrito. The El Cerrito Martin Luther King, the El Cerrito Branch, the Human Relations Commission. I can go to this house, my church, St. Peter Christian Methodist Episcopal Church. And we pray that God will put us safe forever in his arms. We have a brand new pastor. We'd like for her to stand, Pastor Johnson, and we want to introduce her to the community. And we just love her. So it's a lot I can say, but there's someone in the house that I call Maya Angelou. And she is the city of El Cerrito's former port laureate. That she did once upon a time. The name of the poem was Diversity. And I'm going to ask my daughter to come very quickly and tell us the real meaning of diversity.
You said you wanted to see me. You said you wanted to see me. But if you see me, you have to see you, because I am one of the many unique faces of diversity. See, my roots, they run as deep as that southern picturesque view in the sky, watching a storm brew. And as deep as the ageless history of the first continent's ancestral instinctive crew. You said you wanted to see me. That's why you wanted to see me. But if you see me, you have to see you. Hence, if you see me and you see we, you see us, you see one. You see diversity has overcome. Yes, 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 especially in 2025, it is still trying to overcome obstacles and barriers that want us to hate. But the beauty in the differences of our cultures allows us to create harmony for us all. See, I represent that far east side Great Wall. I represent Berlin's Fall. Represent the people of Schindler's List. I represent the luck of the draw of the Irish. I can run with the bulls, and yes, I do understand Confucius' rules. I am that powerful right fist, because you see, diversity, it exists, whether you want it to or not. People, we have to live in a world, we happen to live in a world where country is the biggest melting pot. So I question you, what does an American look like?
Are they yellow, tan, white? So there's nothing you can say, and there's nothing you can do, because diversity is one. Diversity is you and you and you. And you said you wanted to see me, but if you see me, you have to see you. And if you see me and you see we. You see diversity. Thank you.
Wow, I can't think of a better way to kick off a program about how do we want to spend $1 billion. Thank you very much. You know, I appreciate this whole series of townhalls we're doing to hear from people and have a conversation, because I want to be able to hear from you, converse, um, tell you a little bit about our process and what we're doing, and also just talk about how this is going to roll out, because I appreciate all the hard work of my staff who have been helping to put all of this together. Cynthia's here, and Robert. So, I think Tommy's probably in as well in the back. So I appreciate the commitment of my staff on these. We did a town hall this week. We did the Rise Youth Center last week specifically for young people. So what say a few words about give some introduction about the context for this funding and what we're talking about. So got it. Everybody doing something. How they doing? I know we church. How they doing tonight? So, I'd like to talk about this. My name is Ronnie Mills. I'm the district coordinator here. I'm super excited to just be able to learn from everyone here. So how this is going to go. So we have a post-it notes in the back. And so for all of the that you'd like to speak on or get more information on, you can write them there. For those that are joining us on Zoom, you can either use the raise your hand function, or I believe the chat function should be available as well. And so, so for each post-it note, they're going to be sticky little buttons that you can kind of put your +1 on there to add your support and that as well. And so that is all the housekeeping notes that I have. And great. Thank you, Ronnie. Thanks. So what are we talking about? So back during the pandemic, the federal government provided funding to cities and counties to get through the pandemic, and specifically there was this federal legislation called ARPA. I think it stands for American Rescue. What does it stand for? Plan Act, American Rescue Plan Act, and so that money's all been spent. Contra Costa has had some leftover one-time dollars. $5 million. We have some other money related to that in reserves, and we'll talk about that later. Specifically, we had $5 million countywide, and the Board of Supervisors made the decision to allocate $1 million per supervisorial district and have some public input about how to spend those dollars in each district. That's not a lot of money, right? Our budget is $7 billion a year. $4 billion, 7 is our health department. Those federal reimbursements. In fact, we're expecting unfortunate cuts from Washington. You know, the federal bill that passed cuts back funding for healthcare and social services dramatically, specifically for Medicaid or Medi-Cal, our health system, which serves 200,000 people in this county. There's 250,000 people on Medi-Cal in this county. We serve through our department 200,000 of them through our hospital and 11 clinics. So we're expecting maybe 70,000 people could lose their health care as a result of that. So this $1 million, for me, looking at the purpose of this federal law, is really about improving equity, closing disparity gaps in health, economic and health disparities. That's how we're viewing it. Every supervisor is taking their own approach in their district, but we're going back to the spirit of this legislation, which is about closing disparities, achieving equity.
So while it's one-time money, we want to spend it wisely with good public input. And the purpose of these public townhalls is to continue to gather input. Going forward, this is the third one. And later in October, the board is going to have some discussion about this. I'm not going to be proposing at that meeting how to spend it, because what we're going to do is gather the input that's come in, and then put together some type of solicitation process for grants. But maybe I'm just speaking generally without having made final decisions, but some grants may be 50,000 and under, and those will be 50,000 above. And the reason 50,000 is a threshold is because we support smaller based organizations that have the capacity to have insurance, because the 50,000 to that nonprofit have insurance, for example, above 50 million. So we're going to be coming out with that, having a good public process of notice about shortly after we finish this whole series of town halls. Spend a lot of money on trying to address equity and close disparities. So again, this is meant to be, what our immediate needs today. And out to say that my crew, Supervisor Glover and I, just passed away, unfortunately, created an Office of Racial Equity and Social Justice a few years ago. And we're working on closing disparities and achieving equity through that office. Initiatives under that office. To me, everything comes down to health and equity, right? What do we do to achieve health and equity? All of the sense, whether it's health, education, career opportunities for young people, communities health, our environmental health, all of those things. Health and equity is really, for me, what it's about. I grew up here in Richmond, at William Cerrito, but I grew up in Richmond. Cerrito High School. My father taught at Kennedy High School. I know some of you were former students of my father. Always used to. How many were former students of my father? I know there's a few of you. Yeah, so it's going to thank you for reminding me of his inspiration. Gauchos, how many gauchos in the house? Okay, all right. There's a few Eagles, Gauchos, right? Okay. Oil. Okay, all right. People went over. Heading back to it's Contra Costa County, aren't we? Our diversity is our strength, and we have a lot of cultures here, right? Nearly 30% of our county residents are immigrants. And we are working to stand up and support our immigrant families. They're also a large part of our economy. Right? 35% of our small businesses in Contra Costa are immigrants. I'm the son of an immigrant from Italy. My son's mom is an immigrant from South America. So we all have our immigrant connections. So bringing it back to this funding, we've gotten good at it along the way. Really, the purpose is for all of you to weigh in about your perspective about how would we achieve equity with this dollar investment. I keep saying it's small because the ideas we have here, so I'm for us to look at other expenditures, other things we do. Back in the pandemic, we put a sales tax measure called Rex. First time in county's history that we brought in sales tax revenue and dollars a year to support health and social services as well as health. So as you get input, you can ask questions and also respond and put it in. If there's other things of opportunities and funding, we can talk about that. I will say two other things about funding. I serve on the Air District, and the Air District recently changed its policy. I had advocated for this change to spend 80% of fines and penalties that we bring in dollars back in the community is assessed. The reason is because if we're going to find an industrial facility, the community would suffer the harm to get the benefit of that. So there was about $36 billion in fines and penalties in both settlement from the Chevron refinery. And their district is actually going through a public process. I've been involved in this. How we set up a process to spend that $36 million. A lot of that is about health as well. The guidelines coming out for that next month. We'll get to vote in the district to finalize those guidelines in December. January would start also for the Ware district a public process to apply for the $36 million. That's broader than Richmond. It's Richmond, North Richmond, St. Pablo's, those that are impacted by air pollution from industrial facilities here. So that, just think about that, because a lot of things you may talk about expressing needs may also be funded out of that one-time effort. And then also, I was glad to spend about an hour last night at Co-Biz with communities who were focusing on issues, establish effort to issues because the greatest disparities exist in this county. Health outcomes in the African American community. By other services that really health and wellness. So separately, we're working on developing some sustainable revenue and funding for that effort. And we have some opportunities to do that. That's separate and apart from 36 and separate and apart from $1 million. Just wanted to note that. So that's why what you're saying to me tonight, I would think about as we look at a lot of other opportunities for funding. So with that, I think, Ronnie, what we're going to do is we're going to go to start hearing from individuals, right?
Yes.
There's a question or something that we will respond. I'm glad to do that. Okay, so we'll start with that, and we're glad to. I just want to acknowledge a lot of people in this room who do a great, amazing work. I work with a lot of you, and I just want to acknowledge that. The partnership I think that we have with community-based organizations, we can always do a better job. But the partnership we have with community-based organizations is important. So I just want to acknowledge, I'm not here alone doing this work. I'm here with all of you. I just want to express appreciation to you. I want to call it a gaucho over here. I've gotten to work with Dr. Desmond Carson, right? A physician with Lifelong Medical, who has fought so hard on some things. All of you have. I've been pointing out in person, but I just wanted to say it's always great seeing you, Dr. Carson.
If he points me out, then I have to point out my mentor as well as my colleague, Dr. Brazil Carter.
There he is, yes. Right. I think it's sort of right. It's an indication that we all are here on the shoulders of other people, and other people work hard, and we sort of build on that. Yes, thanks, Dr. Carter. Right. So I know. We can ask you to raise hands, or we can start from table to table, and so other people can sort of hear thoughts, and we've got plenty of time. We'll be succinct, but also taking the time to. All of this is being written down, it's being recorded, and it's also being sticky notes. Robert's. We're going to summarize to the Board of Supervisors what came out of all these meetings. We again to young from 2. So with that, I know you're not shy. This is not a shy group. I know that. So someone has to start this off.
I step up.
Yeah, with the camera.
You can step wherever you want. Give the camera to see you. And yes.
Good evening. I get started. I represent as president of the Robinson Weeks Robinson Scholarship Foundation. Like my members of our organization stand up and be introduced. Dr. Desmond Carson, Mr. Pat Durham. And we have other members also that are not present. Organization does is since 1989, we have been an organization that has provided scholarships to students interested in going to the health field. When I started practice in 1979, there were no fewer than 12 African-American physicians in the community. At the present time, other than for Kaiser and the county, there's 3. Myself, Dr. Claudel Stevens, and Dr. Desmond Carson. And as Dr. Carson has told me, he's lost his dream shot, and so have I. So which means we're getting older and we have to move on. And we want to hand on the job of taking care of this community to others interested in going into medicine, as physicians, nurses, medical technicians, whatever, psychologists, psychiatrists. We need the help. And without providing financing for these students that are interested in going into these fields, they have no hope of getting moving forward. So bylaws were written to provide assistance to students from the West Contra Costa school district. And over the 35 years we've been in existence, close to 40 now, we have awarded over $200,000. How do we raise this money? Selling fried chicken dinners, having community events every year. We've been all volunteers to make this happen. But to do this year after year and with limited source financial support, we need from other sources. So we're asking we be considered for a portion of the money awarded that will eventually be awarded to this community to continue our efforts to provide scholarships for students interested in going into the medical field. Not only are we interested in high school students, but we're also reaching out to junior college students who are already interested in medicine. And we also want to emphasize the importance of STEM activities in our elementary schools, so we can get our youngsters on that path early in life, so that when they get older and get into high school, get into college, they'll still consider medicine as a career objective. So with that, I would say thank you for your time.
Thank you, Dr. Carter, for your years of service. Great suggestion. Yes.
Good evening. My name is Kim Jones. I am a member of this lovely church, St. Peter CME. I'm also a member of the Contra Costa County Sustainability Commission under John Gioia, and we're involved in trying to keep our county clean and green and all those things. But I want to remind us of something that John said. I know we came in the room to talk about $1 million, but it's a whole bunch more than that. So don't let your ideas be too big, right? Right. Somebody just told me recently that if you're thinking big and you ain't scared, you ain't thinking big enough. So we should be thinking big about this. We should be thinking about something we can sustain, to something that's good for our community. And there are no bad ideas here. So I just want to reiterate that we appreciate what Supervisor Gioia is doing, and thank you to our church and my sister here to invite us in here. But you guys, this is serious. This doesn't happen often. He mentioned the Bay Area quality management. I'm also one of the community action plan members. We wrote the document, and it's Chevron is mandated to work with us for 5 years. They can't tell us to get lost when we tell them what to do. And so we're trying to bring some of those resources to Brave with what we're doing here to bring some health and wellness services to our community. So think big, y'all.
Right. Thank you. Thank you for developing that profit reduction plan. Of course, with the Sustainability Commission, it's great having you on there. And it's right. I think as we think tonight, the ideas here aren't just in the $1 million category. Well, we're looking at that specifically. The $36 million will get process early next year, and there's a lot of overlap to achieve equity in those two funds, right?
That's one clear. Like but Kim said, This is the first time in history that the black community has been recognized with these finances that became down this refinery. And I've been all my life, and I've seen some mentors, calls some students, some counselors, all mentors. But I took it for myself to say to Richmond that not this time. I'm going to give us that coming. Our families had 5 generations who were on the refinery. That's all we worked out. That money's supposed to go. It's supposed to go to us. We're not organized enough to go internal. So we formed an organization called the Black Excellence Coalition. Y'all been seeing newspapers. We talk to y'all, we talk to city people. Depending on money. We got excellence for anything. Money to make sure that our economic power and local awareness can affect our community for moving forward, not backwards. It looks like to have a relationship with the farm. It looks like to have a relationship with individuals that devote about our health in wellness, not mental health, because we be coming for that. But mental wellness, reach out for it, right? Education, resources, economic empowerment, housing, touring. This is what this community needs, because that's what we were lacking. That's why we're just like economic. Everybody who reads say the words, gotta know what they mean when they say their words. This brand that you think is. And so that's what we formed this coalition with that from Richmond that all life that can for everybody else, but not for ourselves. For ourselves. For ourselves to better people. I'm not doing this for Angela. I'm doing this for my predecessors who town who died and never was recognized. Same Richmond was that shipyard. Our parents and grandparents came to a shipyard and worked. We're not supposed to stay in Richmond, we're supposed to leave. We stayed and we ended up getting redlined for 25 years. Sources. Now we got this $550 million from Chevron in the city on the place of their campus. No. That is reparation for those who was exposed to Chevron. And we want our just dues. I ain't talking about county money, county money. I'm talking about what somebody. We'll talk about that, but let's shoot.
I can clarify that. Because yeah, I was referring to, some of you know this, city of Richmond had put on the ballot a tax measure, an additional tax measure on the refinery that Chevron knew was going to pass. So it was a settlement between the city and Chevron that in putting this measure on the ballot, that over the next 10 years, Chevron would pay the city to its general fund $550 million. I think it's 50 million over 5 years and 60 million over 5 years. So it's an average is 55 million a year. And the city council hasn't yet finally decided, but they're considering how do they spend that money. And I know at the Twan, we formed, some of you are here, an organization to really advocate on behalf of a large community of Richmond, the African American community, about how should that money be spent. So that, I think, is what formed the genesis for this group we talk about. But it's a great advocate in these other venues, whether it's the 36 million from the air district, whether it's $1 here, it's just other issues as we talked last night about we're creating a source of funding for African American business. So anyway, I think just want to clarify that $550 million. You can tell me how you want to spend. You have to take that to the Richmond City Council. Thanks. Right.
Good evening, everyone. It's Michelle Jackson, and I'm a member here at St. Peter CME Church, and I'm also an advocate for Stige Elementary School. And I just want to thank John Gioia for this opportunity. And as everyone said, this is the first time that I can remember that we have been included in a setting like this to have such input. But what I like to say, I want to go to Dr. Carter and his request about the mentorship for doctors at the elementary school level. I have 2 points to make. That's the first one, because if we don't put the health and wellness at that age and have some type of continuum of services to that age in the elementary school, it'll be like everything else. The money will come and go. So my challenge is for us as we rebuild Steve Elementary School, and everyone has taken a part in that. We want to make sure that Steve is a STEM school. I like to see Steve when he says, watch that video about Steve Elementary School and the condition that the school was in. The very first phone call I made was to John Gioia. And I appreciate that, John, because you helped us. The second call I made to John, trying to find funding, they were already meeting about Steve, and staff knows that. And that was a great asset to us to get that school rebuilt. Steve, a STEM school with a medical emphasis, with a partnership with Contra Costa College. I see that as a possibility, because we have to have some system that provides service to the education of our people. That's number one. And I'd like to see it come from the medical field, because we have the talent here to be on that campus, to recruit young doctors that's going through their internships and have that internship. Somehow those practicums start right at Steve Elementary School, because that's where it's needed. My second issue that I like to say is that we're here, and I can go down who and what everyone represents. I would like to see this setting take place in Crescent Park. Let's hear from the voices of those who need services. I'd like to see this setting take place in Kingdom. I'd like to see that. John will do that, because we know and we've had the experience of doing this type of work and opportunities before, but we don't want to plan for something that we're not going to use. We want to go to the horses and talk to the parents in Crescent Park, Deliverance Temple. I'm just speaking for my East Shore community. And Kennedy, because I know that Antoine mentioned something about mental health. We do that. And I see Sister Cheryl from Fierce Advocates. Our parents are in the whole family. It's a systemic situation within the family structure to take care of. How we do that, I don't know. I have some ideas, but I want to not mention that for these funds and this community, because that's what made us who we are. I can go down and call all these parents and these type of services here, and that's why we're still here. So we need to offer that to the next generation. And I thank the staff of John Gioia for being here, for doing this. This is a wonderful start. Thank you.
And Michelle, thank you for your lifetime of service. You know, I think what's great is if I would add up the years of service of all of you here, it's hundreds or thousands of years. Lots of time. It's a long time. You know, when you mentioned Steve, it was really the community with leaders like yourself who said a partial rebuild of Steve is not equity, that is not fair. And I remember when you called and the community rose up. You know, the community in this area is really the voice effective. And, you know, we were having some meetings with the superintendent, including the superintendent, our state superintendent, Tony Thurman, who was involved with some of these, who's from Richmond, of course, and others, to say, yeah, how can we find, you know, trying to really advocate and pressure the school district to identify the money. And it started though with the community. I feel we were a voice for the community. And the result was, as you've seen, that is a flat fact. because the whole thing is getting rebuilt. And of course, Kennedy, right, is getting, much of that's getting built. And I was at the Richmond High, so Richmond High for you Oilers is getting rebuilt. I mean, so that is really, important. So standing up for Stage, because it was not going to get built until the community said that's not enough. We need to rebuild it. Thank you for that. Well, Ronnie's got this mic. Okay.
Oh.
Yeah.
Speaking of redlining and reparations, I'm the Black Builders Fund, which is a fund started by Arlington Community Church. And the fund helps first-time Black homebuyers through zero interest loans for down payment assistance. We started the fund in 2021, and so far we've given out 46 loans to first-time Black homebuyers. Biggest, it's evidence in Contra Costa County, although we've had a couple of ones in Solano County recently. But I'm here to say we would love some of this money to help keep our fund going. We've raised a lot of money. We've given away everything that we've raised. And we have a resource now through which the housing services are the ones who qualify the applicants for us. There's people waiting for this money. There's a program set up, and we'd love to have from this fund to help keep us going. Thank you.
Thank you. And I remember when we met at church, I mean, you advocated to think about ways to bring more funding. And I know I think it's an example of this church obviously included, that we have so many congregations here in this county. Faith community has really been a strong voice and really a lot of initiatives, the Greater Richmond Faith Program, which is a lot of the congregations are in West County that built family shelter. So I think we're so fortunate to have active congregations here in West County. And thanks for the work you do at your church. Speaking of church, speaking of faith.
Hey, you doing that? JW said hello.
Thanks.
I wanted to say ditto to Colin, but I think putting that together sends out a large vision, but Kim was saying, because I remember some years ago, we fought for a community benefits agreement. You see, Berkeley was coming here to do a campus. And they were inviting universities from around the world to come here. I was part of the leadership team to try to develop a benefits agreement. And our purpose was, if you want to bring global education in our backyard, our schools, Stage, Coronado, and others, at that time were performing out of 50 states down in the 40s in education. And we're still something at that level. So when you talk about bringing STEM and those things and mentorship for doctors that are coming out of our schools, it must begin at the elementary level, because we're not producing the quality of those. And I say that because I was afraid to send my own children to the public school and started one for a little minute so that they can continue their private education. And so I'm an advocate for the position with I worked with mental healings and such kind of thing for Steve School. But I'm going to advocate for that still. I'm going to advocate for the education, and that's what excellence is about. The Excellent Coalition is to provide that mentorship, that education, and development for our youth. Because if we're going to have any type of future, in this county, in this community, as an American community, as a level, that's diverse. And you know, we've been together for years. And I think that if we come together, the coalition, foundations, the education, we have to present ourselves cohesive and collectively together in order to be powerful to go after what we need. But I think that's the backdrop of what my brother Kim is saying. If it's not, so since you put me on the church and faith level, I'll say it this way.
Is there to be a level?
If it's not God size, if it's not a God size vision, then don't go after it. But if it's a God size vision, some that it can only happen by faith and the work that we put in our faith.
Well,
We can make a difference in this community. And so I stood to say because tonight is my wife's birthday.
Yeah,
I didn't think
early if you want. Yeah.
and I'm gonna hit the door.
How come you didn't bring her here? We had dinner right here.
Well, buddy. The grandmother in the restaurant. She dropped my little one off. His big brother is taking him to Spokane, Washington, where I sang his son and plays with Gonzaga. And he's going to, he's turning 13, but he'll be 13 at a Gonzaga game.
Thanks. And thank you. Oh, thank you for spending part of this important day with us. See you, man. Yeah.
I'm gonna support whatever group. Cause y'all know I don't mind standing in front of both.
Want the mic again?
Thank you, sir.
Is the floor back open, John?
Floor is open. Yes.
Hi, everybody. My name is Maisha. My name is Maisha Woodard. I'm born and raised right here in Richmond, off from Crescent Park. My mother and father was born and raised here. My mother's from Crescent Park. My father's from North Richmond. So what I want to come here tonight and address is, so I'm one of the people in the community. I move very cautious. I move very cautious on who I spend my time with, who I meet with, who I contract with, who I partner with, who I become friends with. I'm one of them type of people because when I came home from serving a 6-year prison sentence, I was well in my making sure formerly incarcerated women don't experience what I experienced. Coming home homeless, denied 26 jobs, helpless, right? So I started that mission. So then when I came to my own hometown, what I noticed was we had a lot of people in Richmond speaking for us. A lot of people in Richmond speaking for us, and they have not endured the trauma from this community that we had. They think the desk is and speak on what they feel the communities need. I always tell people all the time, Mariana, know this about me. I say this in a lot of times because I'm very blunt and I don't care what people think about me, right? But I say, we can make us Richmond as pretty as we want it to be. We could put all this infrastructure, put all these restaurants that ain't owned by none of us Black people. None of our youth is working in them, right? I can get a million emails of fellowships that's coming out for youth, but they can't help my youth because they can't go to that part of town. They can't go there. They can't vibe there, right? So what I did was, I remember the first time I turned down an opportunity that could have set me up for a long time, right? But it would have been taken away from the people in my communities. Whether it's the South Side, whether it's North Richmond, whether it's Central Richmond, we are all still one. And what I didn't feel comfortable doing is going behind people's backs, eating off my communities, without all of us in Richmond trying to come together and work it out. Okay. One thing you got to understand when you're making these type of decisions, and this is why I appreciate you, John, and this is why Mariana know that is people might be jealous that you actually got me here, Maisha, right? Because I don't do this. I don't do this.
We're honored to have you here.
So I don't come in these type of rooms, and let me tell you why. I'm either gonna come with a problem or I'm gonna come with the plan to fix the problem. There's only two things you're getting from me. And the only reason why I ain't got a bunch of data in my hand like I run around is because I was coming from a youth. One of my youth just moved in their apartment. But I just want to say this because I could sit and talk all day like you, Antoine, right? I could sit and talk all day. But what we have to do is remember that it is some people in these neighborhoods in Richmond that when we go back to talking about mental health, right? We've heard that mentioned a million times. I'm here first to tell you mental health is not a priority to the Black communities. It is not a priority. However, it is needed. Another thing too, I remember my first time talking to mayors and everything. I remember when I was just fresh, young, running around out of prison, and they thought I was just this young Black girl running around. And I think what I've heard from other people is, well, since she came home from prison and she ain't asked for one piece of funding or money, right? And we're gonna talk about how many contracts I didn't turn down, right? Because if it ain't for my people, if it ain't finna come to the trenches, to the ghetto, where people scared to come, because I've given many opportunities and invitations before events start getting put on and everybody start want to make their face known to televisions and TVs. I've been trying to get people to suit up in their hoodies and sneakers and come in the trenches. So these young men can tell y'all what they need, right? Because y'all sending all these organizations through our communities, dangling checks over our heads, it's not going to work. But keep in mind, we do have some Black communities where us Black folks are at odds, right? But do we take that data and we forget that in order to even have a Richmond, you need the Black ghettos. We make this city. We make this city. Nothing goes through here. What do you do if you want to bring a tourist to Richmond, right? What you're going to do, just take them along the curbside and say, hey, this is Richmond. You can't do that, right? So this goes back to me talking about the youth entrepreneur shop I opened up at CoBiz, right? You will think I will run around the whole Richmond talking about this opportunity. No, what I do, I get foot on the ground. I get boots on the ground. So me and Mariana had a brunch a few days ago. I handed her two important things. I handed her a custom-made portfolio blueprint of the data that me and my teams collected solely behind the scenes, without a round of applause, without anything. And we did it at a very low cost. That's how we did it. You know how many families we were able to help? It ain't being talked about and noted. But what I did is made sure that, and I've always made this clear, John Gioia, to everybody who has been, tell you this. I said, I give this community by the end of 2025 to figure out a way for the Black communities. I'm coming with smoke. I said that. So they can't tell you that they've ever met me and I've never made this clear, right? And this is why I protect places like Ensuring Opportunity and RCF. This is why I protect them, because we do have some Black people in our communities that ain't gonna understand the benefit of opportunities, because with those opportunities, we can make our own money because we're capable. But you can't come dangling a check over a bunch of people because yes, we're going to take it without the proper resources and steps that takes to get us to a successful point. Resources are played out. They're boring. Not everybody can pull up at City Hall and get a resource. So for me, like I mentioned when I brought the housing program to North Richmond, right? I sat in front of a community with women that I didn't used to get along with growing up here, right? And I made it clear. I turned down positions. I turned it down because if us as Blacks in every community ain't gonna eat together, the system will not tear us apart. And the city is a system. It is a program system. And whether we in the welfare lines or whether we in the Medicare lines, Black people, we go through a system. And so I want to make something really clear. I remember one thing I did for RCF, Richmond Community Foundation. I took every initiative and I gave it over to Jim and Ms. Mariana. And I said, keep this forever. And what I did with all of their initiatives, I revamped them and created them to be specifically built for the Black communities. Now, this is not something we brought to real life. But it was because of my dedication to that organization and me telling them, hey, I feel like you guys are one organization that can actually help the Black communities. But you have to be willing, you have to have the power. The people are the power. Because if the people wasn't the power, the job already would be done. Conversations already trying to do with $1 million. Conversations. But you can't come and build a method for us and think that's how we're going to survive off of it. Because behind the scenes, we survive in the ways that y'all can't even fathom. So one thing I love that my Central Richmond crew right here, right? These are my girls I picked, right? Keela, she's on live somewhere. She's over the North Richmond area. Southside girl, her daughter got sick, so she's not here. Marche, she's not here. But when they first started the community zone data project, and of course, me and Mark getting here in due time. So we didn't bring the magazine. I also have the magazine that's going to be illustrated out to Contra Costa County, right? And I have the data. And so what I love is that I built the community zone project for Black people, right? But what I love so special about the Central Richmond team, when they called me and they said one thing, they said, well, are we subjected to just helping Blacks? What about the Hispanics? And if you know Central Richmond community, they're made up of 75% of Mexicans and Blacks. I mean, the households there is a Mexican father, a Black mother, a Black mother, and a Mexican father. I said, yes. I say yes. Because they just as vulnerable as us. We have to understand that they're just as vulnerable. So when I came into my communities, right, I said, we have this is when I first collected the data, you guys. I only counted 15 plus organizations within Contra Costa and West Contra Costa. And everybody knows me. I speak my mind. I said, I speak my mind. And I always talk about data. And if I had that data in my hand, you guys hear me talk about data because you can come in as many town halls as you want, but you have to have the proof in the pudding, right? And I have 125 signatures, by the way, that will be in the back of the catalog, just so we can know the data is accurate.
And I know you speak on behalf of a lot of people.
I guess.
Need more time.
No. You chose out saying this. In these ghettos in Richmond, we have a lot of smart Black children that need opportunities. It's a lot of young girls that I work with who still is mine. Just my two siblings. So it's a lot of fight that we have to fight, and the city have to be willing to put in the effort to give us a chance to fight for our own communities. Give us that opportunity. Don't look at us as criminals. Don't look at us as problems. Don't look at us as violent committers. Don't look at us like that. Look at us as human beings. So in due time, John Joy, you see why I feel like a portion of this funding can go to shaping our communities. And of course, I don't talk too much when I'm in public places because my methods is secret. Right? So thank you guys.
Thank you. And I think it is important to allow people the time to talk because, we have a group that's, small enough to give everyone a chance to really express how they feel. And I really appreciate hearing that. It shapes me and, it makes me better able to advocate. I wish, I would have to play a tape of this to my colleagues on the Board of Supervisors. So they can hear everything you're saying here too, because I think Marianne, you some of our meetings. Sometimes my colleagues don't hear all of this every day. It's so important for them to hear this. So thank you for speaking up and speaking out. Thanks. Right.
That was she was preaching small. It's for the this community. And that's in city of Richmond. I could have done absolutely. I've already said exposure is expansion. Now in the healthcare field, Robinson Trumps, I see the importance of this race professionals. So one of the guys I'm not going to see them asking, how are you? There's a separate knowledge that Dr. Dusty information. It's not just the knowledgeable. I see these kids, but they never. Father is taking out kids. Kids to it with them. These are some kids that I worked with, the young adults had to compete with. Sure. Look at our children. Look at our children. To get system. We have to stop. It's education. We have people. Long dialogue. The school never looking at people. The education is the key. Steve has to become STEAM school. It has to become, and I don't mean just the share and then we do it. We can dance, we can sing, we can play sports. Try again. City. Kids from supreme. Have to do it, have to be challenged. As long as I challenge them, fast and close, they got it. I met them when they were. Okay. So there's the thing has long I think it was math teaching a thing. Well, it's such a joy to develop. I'm supposed to get math at this thing. You can something that way. And then I see them young adults trying to jobs. Without you pay money. Got a math test for me. I'm at the city. They share a couple of and she guys. There was a segment of the population came up there back in the desktop down. I could see that not on the test. Teach to the test. That's what I thought was really the education system in stage. But the education I got it's completely different. Because of that, I'm showing that and thank you.
Hello, it's Kataja. I'm not used to speaking. I got a little, I shy. I'm not used to speaking. I just wanted to touch on what she was saying earlier about our communities and basically from my point, I'm a person that for the last 7 years, I want to say since 2018, I've been doing backpack giveaways, Easter egg hunts, Halloween parties out of my own pocket because I see that in my community, a lot of kids wasn't as fortunate as I was growing up, or just if you come from our community, you like and what it is just by seeing a person whole presence. So I took it upon myself to say, hey, you know, I'm gonna give back to where I came from because I didn't have this. If I didn't, she didn't come to me with the opportunity, my freedom, and go to get signatures and see who needed and all the etc. things that comes about besides of what I was doing. Like she gave me the motivation to keep pushing because it was like this year I almost gave up.
You didn't, but you didn't.
So today makes 1 year I lost my oldest brother. I wouldn't even made it to this meeting today because another thing, just a second, even though I'm running on, mental health is real. And the black community are told to be quiet, we're told to not talk to people, we're told to keep what goes in the house stays in the house. That affects us. I'm 37 years old today. I just started talking to a psychologist December of last year because my brother died second. I thought it was okay to talk to nobody. So when my friend came to me with the opportunity, she's like, I've been seeing what you've been doing. I think you fit, you one of the, excuse me, because I'm so staggering on my words. But one of the perfect fits because of what she's seen me doing already. And I jumped on it instantly. I'm like, you know what? I've been doing this out of my own pocket. I still will do it out of my own pocket. Still have done it out of my own pocket. But if we can get funded, if it is funds out there that I never knew about as of today, and I've been doing this for 7 years, why not get on? Why not get on board? Even if I don't get nothing out of it, I'm doing it to get nothing out of it. I'm doing it to show these kids that it is people that care, that understand, that comes from where y'all came from, and that wants to see y'all do better and wants to change the narrative. And I want to break the cycle. I'm in the cycle because I have a 20-year-old, a 15-year-old, a 5-year-old, and a 3-year-old. Okay. So with all my children, I have broken the cycle. My child at 16, I'm from Central Richmond. So if anybody is on the difference in how it goes when your parents doing and you come from the 80s, the epidemic, I don't want to say, but you get what I'm saying. As you don't really, the parents not really paying too much attention. So I say all that to say, I appreciate being able to even step and be in this room, especially on a day like this where I shut down. I'm the type of person to shut down, just go silent, go mute. You'll see me once I'm back, and I feel like, I'm the woman of steel. I don't like to let nobody see me vulnerable. But as I start seeing these kids, like, you have to be vulnerable. You show them, like, I understand where you're coming from. I feel what you went through, and I'm trying to show you it's a different way. I'm trying to show you it's more to it. I'm trying to show you it's people that actually care, and it's okay to speak up. No matter, this is what I tell the kids. I don't, it's anything your parent tell you. If anything comes to me, and I feel like it's a life and death situation, or if it's a dire need to tell your parent, I will tell your parent. But I want to I leave my doors open, ears open for you to be able to come communicate with me about whatever is going on. If I can help you in any type of way possible, whether it's taking the shoes off my feet and giving them to you, whether it's taking the coat off my back and giving it to you, I will do that. But at the end of the day, I just want to say I appreciate you guys. This is the first time I ever even experienced an event like this. Like this is big for me, especially on a day like this where I just be in my room crying or something and not even trying, and then just coming back out and here, guess what? And 3 more weeks, I'm finna throw this Halloween party, but nobody knows that the mental things that I'm going through in the inside because I'm keeping it in. But how can I show these kids that it's a different way of going about it if I just stay in my shell when I get in my mode? Now I'm showing them, like, hey, I'm outside. Now I can show my kids once I get back to where I come from. Hey, even though I'm used to shutting down, I didn't shut down today. I came to a meaningful event. I came to something that actually could possibly, I made it to something that actually can possibly help us. Even though I've been helping y'all, we can get more help. Like literally just make it bigger, not just me solely me. Like, you get what I'm saying? If I can get an organization behind me, if I can just get one more person behind me that I can show a diversity, it goes back to that diversity. And I am a mother. Kids' dad is Mexican and I'm African American, so that's another thing. Like, you get what I'm saying? Yeah. So. Exactly. Thank you. You came. So, and then my 2 kids are just fully African American. So I got 2 different cultures going on. Where I let my younger kids, I want y'all to know both cultures. I'll let y'all choose which way y'all want to go. I'm not going to say you got to be Catholic or you got to be Christian. I'm going to
Beginning about diversity.
Yes.
Right? About diversity.
So I was like, that's who we are. There you go. Yes. Sorry. Mine is all over the place. So emotional, but I just wanted to just say thank y'all. I appreciate it, Maisha. Thank you for giving me the opportunity. And because I actually love it so much, I started to feel like I was overlooked. Even though I wasn't looking for anything in return. I was feeling like, dang, is it just only me in this community trying to show these kids it's more to what they never see? Just me stepping in this room today showed me it's not just me. I'm not. And
Thank you. Thank you. See, you're an example of why I want my colleagues on the board to hear your voices, right? I mean, it is so important to get nothing more powerful than the lived experience, and it helps us advocate and be the voice for that. So thank you for being here. You know, and Mitchell, when you talk about, formerly incarcerated, right? And I know there's others here who formerly incarcerated, who've gone out and done amazing things in the community. I think it shows that when we invest people, the return is there. And so I want to especially acknowledge, because you've gone through challenges, you've overcame a lot of racism, a lot of obstacles. And I just had a chance yesterday to be out and see the health facility beds that are being built at the West County Detention Facility. It's like a hospital within jail facilities, right? And working with the stop reentry center. There's others here. Is Antoine still here? He left. A lot of the work. So that focus on reentry, that focus on the challenge that you talked about, and I think that's why we're trying to keep track. And $1 million is not a lot. There's other funds, and this is all helps inform that. As we're trying to figure out the sustainable source of revenue for African American women's and health. I mean, so all of this is really powerful. So thanks.
It's showing opportunity for our whole team base with 17 coaches ready to come into the community. Hey,
I think I'm going to take it in the order. Dr. Carson, is that what was next here? Was it? Oh, okay.
Legs first. Legs first.
He's the gentleman, always.
Exactly.
I'm glad to be here. My name is Alicia Montaña. I'm going to have today. I'm a pastor in a Hispanic church in Concord who represent them as they go to struggles, pay the rent, giving things to because they don't have to do the end needs. It's hard to work with a community who is struggling, working hard. So I represent Juntos, which is a non-profit organization who is set here on San Pablo, and I have the privilege to be part of this as a volunteer, as a member, as a San Pablo resident, and also participate in the program with the supervisors. I used to sponsor. It's called Pasos. He motivated us to work. I think it was first
every Thursday night.
Thursday night. And I'm so glad that I was able to come here and focus on the needs of my community. You are part of my community too. God bless you too.
I want to say something. Rising to us, working on park equity. These are parks used by African Americans, Latinos, Southeast Asian, and and I really appreciate that effort. I'm sponsored along with Rising Juntos every Thursday night from the park, right? At 5:30, a doctor out there. Speaking of doctor, from doctor next, where and resources and exercise and activity, using the parks, accessing the parks. And these are parks used by everybody, the University of West County. So thanks for that. I need to say something about Dr. Carson, because it's a theme about what we've been talking about tonight, about cultural competency and having serving the population, which gets to, the discussion about scholarships for young African Americans to go into science and things like that. Virgil, we talked about that. That kind of message about vaccinations and getting people to come in and get vaccinated to protect themselves. And there was a gap between the right in terms of the rate of vaccination. And the county was really trying to put a message out to its county physicians and others about the importance of the African American community being vaccinated. The county messenger was important message. And this, when there was some county physicians out talking about the importance of vaccination, it wasn't having the effect in the African American community as it should. But having Dr. Carson at a press conference at West County, and having pastors, right, having physicians like Dr. Carson put that message out, it's what got the country more engaged to get vaccinated, because they were hearing from someone they trusted, they were hearing from someone they believed in, they're hearing from someone important to them to do. And so I just want to acknowledge that's what I'm hearing a lot of tonight. That's what people expect, preserve. And so I just wanted to thank that.
I appreciate that.
But he's a gaucho.
Yeah, I'm a guy. There's a couple things.
He's the make, so
There's a couple things. Dr. Carter and I, we go on a daily basis to a conference called the National Medical Association. These are the Black doctors that talk about health disparities. As I was together of disparities. Talking about mortality, whether you talk about diabetes rates, hypertension rates, when you talk about strokes, atherosclerotic cardiovascular disease, when you talk about multiple infarcts, when you talk about death rates, whatever you talk about, from the room to the tomb. Some of the reasons why. One of those is that education. And stuff is still from trouble. You see people coming with blood pressure of 200 over 150 and wonder why they got it. Yeah. But you tell me they can live all night, and the reason because they drink the water, their blood sugar is 491. Well, to what? Say I ain't strong in the day. That's the only reason a man don't come, right? Right. I'm telling you all from a couple of vantage points. One, education. I was blessed to come from Catholic school in Berkeley. When I got to Richmond in the 6th grade and went to Florida, I went to Florida. I was raised right here. I saw Ricky Jones playing basketball right there. I was in Show Park. That's where we played. In Show Park. That was home. I raised right away on Flint. 2 blocks right, my street ran right into Wilson Park. That's where I was raised, right? I done seen everything everybody else say, yeah, I know how to Jordan, right? That's the name I come from. So we keep it 100, as we said. The point I wanted to bring to you, though, is when I got to Florida, I was from certain classes. I told my mama, I did all this stuff. Go tell the counselor. I'm like, oh, my mother and touched everybody. And then I'm just here to tell you the reality. I was part of the classes where everybody was born out demons, and there was another couple of kids there that was black. All the rest was white and Asian. From the 7th, 8th, 9th, 10th, 11th, we were all matriculated to the same classes. And half of those kids went where? Berkeley. Half those kids went to Berkeley. What did that tell them? Your kid is not on track back in the 3rd or 4th grade. It's been said here. It's been said here. We have to adopt culture, education, not your damn Nikes, not your Nikes. We have to adopt culture where academia is the most important thing. We have to adopt a culture. Our kids come home, they go play football, basketball. I love football, basketball. They have to do their homework and they have to be on track to make sure that academia is the most important thing. That is most important. Do you know the sign of 30 degrees? Do you know side angle side? Do you know what the cell membrane looks like? That will get us to the next level. That is what I believe is the next most important thing. Making sure our babies have their education, and we as the family need to be asking and checking them.
Yeah.
We have to check. You not at home. Not doing your work. That is what's going to be. I believe, and it's just me. That's what I believe that takes us to the next stage, the academia of our children.
You know, Michelle gets back, you know, like Michelle talked about at the beginning about why it was important to rebuild stage, because that's elementary school, right? Young people deserve the best facility, because that's a representation of our priorities and values of investment. And that's why I think we're starting to rebuild stage. And then something we've talked about stage being a STEM school. Yeah. I want to make sure we hear from everybody. It's to speak before we Right.
You can say something in a minute, buddy. Okay. Okay. In just a minute, sir.
Hi, everybody. I'm used to talking to 2-year-olds, so be patient with me. My name's Cerise Mills, and I own the Point Playhouse Early Learning Center just on the other side of me. I'm here representing early education. We can't talk about education without talking about early education because that's where it starts. 7% of Black directed centers here in the state of California, and programs is Black owned here in this community. Yeah, and I've worked pretty hard also to bring some other that there's a program that just started. That's fantastic. Happy that would do so the cultural learning program, and there's a lot of intention because I noticed the school she was seen. I wasn't feeling like she was seen. Feeling like, she was the beautiful community. So with intention, I share that. I think it's very important that additional funds go to support education. There is about 1,200 licensed facilities here in Contra Costa County, and thankfully there were some funds that were dispersed to help support through each boost program, which went to help with retention of staff, because we're losing a lot of our staff to other counties that are able to pay wages that we can't pay them. That's really misfortunate that we haven't the resources available to staff in the way they want to. And so there's a lot of for the wage boost program, and the programs didn't receive any support. Is one of those, and it's really by the grace of God that we've been able to flourish and do well. I do see that there's a lot of programs that have been very impacted, and so I would like to see these funds go to help support education, and also to support small businesses, specifically in El Cerrito. I'm going to speak on that specifically because when I was opening the child care center, I reached out to city council. I reached out to the city to find out what's available to help businesses here, because I'm struggling with navigating the permit application. I'm struggling with these fees that I didn't know how much the permit application was. To find out that the funds that were allocated to the city of Oswego were not given to support small businesses like it was in Richmond and like it was in Pinole or surrounding cities, but it was used internally in the city. And so fantastic, in good faith. There was an opportunity for education in this area and also for small businesses to have that opportunity to grow and to thrive because we weren't able to.
Yeah.
Yeah. I've got a lot of grit. Support from the community. So see a lot. Childcare is open here in this community to feel supported also. So thank you.
Thank you. Thanks for being a leader. And, we allocated some money out of your X toward early education, including some ongoing funding. We upped it and increased some more to see what the status of that is because that we put some out ongoing application. Not of these other dollars, of course, some of these could go to that. So, but we use Measure X dollars as well. Cheryl's, I think, next. Cheryl, yes. Sorry. Oh, no, go ahead. Yes.
Good evening now. I do belong to this church, and the one concern that I haven't heard much about is the health education. When I first moved to Richmond, and it was in the 50s, we had 4 hospitals. We have one in Richmond now, Kaiser. I worked for public health for 30 years, and I managed the public health clinic, but it was an STD clinic in Richmond, and Dr. Carter had started. When he first came to Richmond, you were working in my clinic. And I then started working with people when the height of the AIDS pandemic and epidemic is what it was. And we really didn't know what it was at first, but then we eventually found out, and we got a bus and we had a mobile clinic. We were doing a lot of testing, but we had to figure out to have them to come back to find out their results, because they would say, "Oh, I don't want to know." They were afraid. I had to go out to the high schools and do health education, and I had a clinic in Pittsburgh and one in Concord. But Richmond is where I lived, so that was where I saw most of the real problems there were always problems, but this is where my heart was, here in Richmond as well. And so what we had to do was to find back in, and it was through food. I used to buy chicken, and we'd go out and let it smell good. It was day to get your results, and if you came in to get your results, then you got food, because there's so many needs here in Richmond, and the younger people, they were getting younger and younger. We had a syphilis epidemic, we had an AIDS epidemic, and young people were really sick, and some actually died from AIDS.
Yeah.
And it was so sad because it wasn't enough education. So when Chevron comes up with this money, not just the million, because that's not
Talking 36 million.
okay. So that's what we're gonna need a lot of it. We need to start having clinics opened again. I noticed that they're closed in Richmond.
The county's North Richmond Clinic is still open. Richmond is still open.
So, yes, but 37th
Yeah.
shut down.
That's over in San Pablo.
Right, San Pablo shut down also, but it's still the community. That's all we have. And then Kaiser, people go there now just as a primary source of care, not an emergency. That we have emergencies, sometimes they can triage and have the ones ahead, but we have so many people that that's the only source for their medical, for themselves and for their children. And we really need more medical care.
Yes.
And education.
Thank you for your service. I'm making less comments between comments because I want to hear more from you so that we can hear from everybody.
Thank you. My name is Cheryl Lane. I'm freshman. So I'm executive director of this organization, freshman called Fierce Advocates. It's building blocks for kids, BBK, for 20 years. Now, I was also on the African American Homeless Advisory Hub subcommittee that the county did to figure out what it's going to do with the hub. In any case, all the stuff that you all mentioned, I feel like I don't have to repeat. Like I was like, ditto. That's all I was going to say. That's what I was going to say. So some of the things that y'all haven't seen that's connected is around maternal health. I know Dr. Carson mentioned that one of the things our organization does, and when I speak, I'm like, oh, you know, a lot of times when people speak on behalf of the organization, it's not like our organization getting funding, it's not for me, it's about the issues. So for the issue around Black maternal health, physicians and healthcare providers know the stats. Black working folks, Black women, Black men are 2 to 3 times likely to die in childbirth. Babies are more likely to have health issues born preterm. One of the things that we post, which I always say everyone should have, especially Black women, is a doula. Have a doula program. Graduated 16 women in our program. We've helped support close to 300 births right now in Contra Costa County. We are Black serving. But I mentioned that anything because we talked about culturally competent, culturally whatever culturally you want, but it has to be like us, right? Like it has to be us because they don't listen to us, right? Okay, they don't. And so the importance of whether we're starting with staff, okay, words, the healthcare providers, whether you're a midwife, your physician, does need to represent us. Like they need to look like us. I'm saying I'm the pain. You can't look at them and say, no, she's not in pain. She's a big girl. No, I'm in pain, right? So I just want to just ensure as we're thinking about funds that we're really thinking, you said from the room to the tomb, literally from the room, that we're really echoing that. So I really want to echo, you said it all, so I don't have to share. It's really on the issue of mental health. A lot of times folks, I'm seeing less stigmatization, but there is still that. But I've heard folks in our community say they actually do want it and need it. It's because I'm stressed or I have anxiety, I'm running on time. Grief. Like folks need it, and we need a way to provide it. That again, the provider looks like us, informs us, understands us in community, right? And oftentimes when you try to go to a provider that you feel is more connected to you, it's so expensive. It's $250 an hour and up. So as we're thinking about resources, it's like how we bring mental health care in community where folks need. And then lastly, I know a lot of you, I keep on saying lastly, so sorry. I know a lot of y'all work with youth. I say the youth are brilliant. They just need that resource and tap. They're struggling. But they are struggling. We talked about literacy, they're struggling. Math, they're struggling. And our schools are not equipped to provide them with the resources they need. I'm somebody who cusses out all the time when needed. But a lot of parents
They don't have the time, they don't know what's going on. And so our babies are struggling. And I see it when I volunteer at schools. It was one day I volunteered at the schools, Korematsu, formerly reported that I came out like exhausted. The Black girls were looking at me like they wouldn't want to fight. And I'm like, and I'm like, I'm just here. Because they in pain, they sad. They're going through a lot. You know, cussing out at school. I'm like, they let that. And so we focus a lot on which we tell that our girls are struggling. And so I just want to say, as we think about these youth that are focused, resources that are focused, not take that 1 million, okay, the 36 million, okay, that Chevron money, okay. We got to figure out, because everyone in this room, we all know what we need. The folks outside, we got to get it done.
And you know, you are an amazing mom because Ashton, you're an intern in our office this summer and amazing, smart, mature. It's just like, I felt when we would talk, I was talking to somebody probably your age, the wisdom that you have, not just the knowledge, but the wisdom. Thank you.
John, I'd like to say that he spoke on Sunday morning at our church.
I appreciate it. The voices today is more than just about the $1 million, as we were saying over and over. And I want to come back to what I said earlier, is being up with using the model of the African American hub to create a sustainable source of revenue, which I think we can identify here at West County, because the West County source, folks in the parts of the community can do their stuff, right? Some great needs as well. To really bring together those who are doing basic work. It's cultural. So this discussion last night was amazing. I think here in West County, creating resource. It's not going to solve the problems, but at least to support and honor the work that's being done. And thanks, Cheryl. So I'm going to make sure that even yes, Jeff, of course.
I just wanted to follow up on what.
Yeah, better take a mic. I know you don't need a mic.
I'll take it.
I just want to follow up on what Ms. Lane said. My name is Jeff Wright. I grew up in the city of Richmond. Grandparents came here to work in shipyards. Parents graduated from Richmond in 1948. So we're a long time fixture here in the community. I want to follow up on what you said, particularly speaking about the young women at Fred Korematsu. I have met his sisters. She ended up taking care of 3 great grandchildren. And I got caught up in things in life. She subsequently had a daughter, got caught up in things in life. So my aunt, in her years, retired from the postal service, then today, in order to keep her children from getting caught up in the foster system, in her own years, she took on raising my grandchildren to children tax from Korematsu. And I can attest to the fact that this young cousin of mine carries a lot of burden and stress just by virtue of the fact that her mother couldn't take care of her grandmother couldn't step in, and her great grandmother had to step in. She's 83 years old, now dealing with a 14-year-old. So it's a very challenging situation. Getting to the point of some of the funds that are going to be available, you talk about very stressful for my 85-year-old and having to deal with a 14-year-old. She's in that situation. Very stressful for a young woman, 14 years old,
Strained living with someone who's years old. So that just adds to the element of stress. So one of the thoughts that I have in mind, my wife and I, we try to help develop financially. Because my aunt is that type of person. She likes to have the grandchildren, the children, culturally immersed, exposing them to all manner of things, you know, in terms of the arts and culture. And she was still traveling on trips. It's burdensome, tired, dealing with passion. And when these extra things come up that cost money, if there was some type of fund to help these grandmothers and great grandmothers who are taking care of children, Robin's taking notes of this again. Some type of fund, so these beds come up. And different things these kids will never attend. There might be some money available. Cultural events, possibly different things that will enrich these kids. If there's a funding source available, it help to take some of the mental stress and pressure off. So things of this nature might be helpful too, because I can really appreciate what you're saying and what you experienced at Frick Komatsu. Matter of fact, that's what lives across the street from you too. Thanks, Jeff. And thanks for your service on the planning commission. Anyway, so anybody on Zoom that we didn't get? Tanya, I saw a while ago. Sonia, do you know if we have anybody on Zoom? Check. So last call. This is really powerful. Really powerful. Thanks. Other last call for folks. Bill's family.
You like, I got it now.
Gonna stand next to your phone.
Years old and I'm here because my dad brought me here, and I also wanted to talk about other businesses not supporting Black people. Target, the Target that's close to here doesn't like to give Black people a job, and some other places also don't want to do that. And I feel like that's a little wrong.
Yeah.
Yes.
So, just wanted there to be peace with Black people and other people.
Yeah.
I guess Kalani and his wife have done a really good job raising us. But unfortunately, that observation made by a 7-year-old says a lot. Says a lot about what's happening. Right? And you know, when we set up this Office of Racial Equity and Social Justice, somebody who did this 18-month community process where the community helped develop the specific idea, and it came to our board. There were like 100 people that spoke. Some of my colleagues in the board acknowledge that this still happens today. That power of the 100 voices that led to the broken sleep. There, you know, others were, but remember, that was a pretty telling discussion at the board. Some people said, well, it's there. That's what happens. It's not fact. And yeah. I leaned over to a colleague who said that, I will say who it was. And I said, and those individuals have lived experience when I'm talking about it. You may think it's their opinion, but it's fact. And that's the challenge and struggle we still have with people don't admit that this happens today. And all the places to the lifting. There's still, and we're seeing this, what's happening in Washington. that we thought we had come further. There's a lot more. Which is why your voices are really important. And I feel appreciative of them again to reflect those voices. So we make good decisions about how we invest. That's why I said it's about achieving equity and disparities. That's what it's about. Longevity, yes, we should. We have equity. We have equity.
Yeah.
Right, and Dr. Costa was saying, disparities exist, right? And lower birth weight for young African American children or shorter lifespans, equity gets longevity.
I would agree that the whole issue is can we get to these points where we can solve these health issues? And as Dr. Carter, my mentor, would say, and you just know, first, and let me just say, y'all don't know how many times in the ER I woke this man up.
What people to hear?
I want you to understand, I was the medical director of the emergency department at Brookside, and I did that for 7 years. I got in 1998. When I got Dr. Carter had already been. Dr. Jenkins. Dr. Jenkins was the director of the ICU. I worked with legends. I would do this at 3:00 in the morning to come deal with the patients individually, such that those health disparities were closed.
Yeah. And one other person I know you knew word I just wanted to honor was Jim McMillan. I mean, Jim was the first Black pharmacist in the city of Richmond. A very good friend of mine who passed away just a couple of years ago. He opened that pharmacy in downtown Richmond in 1960. Right, moved it up to Cuddy. You ever go into his pharmacy? Remember, and yes, right. And you go and the pharmacist in the back. You got to step up. So people walk into that pharmacy. Look up at Jim, right? Because I was behind the pharmacy counter, and it was a step up. So like you were speaking to somebody with authority. He was like a community doctor in a way. He talked about those same issues that you with as the first Black pharmacist in town. Of course, on the Richmond City Council for 8 years, but that he was looked up because for one, assistant town.
And we live right over here.
Right here, Santa Clara Avenue, right.
Here. When those people live in your community and the boys can see those kids, the girls can see those kids.
Yes.
One of I've been working with the Richmond Steelers for 30 years.
Yeah.
I am a medical doctor for Richmond Steelers. I've been there the treasurer for 30 years. That's my said what you brag about. Richmond Steelers. Saturday morning, what about me? They were the Richmond Steelers.
Right. So Roosevelt may be the last one. So let's see. Since anyone else after Virgil, Pat, it's started. So it's fitting you're going to close this tonight. Yes.
Would there be a formal application process for this?
Yes, so what we're going to do, I'm going to say that at the end. As soon as we're done, talk about that. Yes. Go ahead, Virgil, go ahead.
Okay, what Dr. Carson was talking about, I remember years ago, the Black doctors in the area could not admit patients in the Brookside hospital. They could admit them to Martinez, Harlan, and Eric. I followed a patient going out to Martinez because on Highway 4 was just 2 roads back then. So still finally got on in Brookside, but they put in an emergency. So for most physicians, you see as a thing, he closed his office on Thursday so he could work, and that was what they offered him. So we could see the Black patients coming through. There's a lot of history in Richmond. A lot of history that just as we talked about, it's different now. Instead, when I was growing up in the same age, businesses every year. Got first jobs on black business. So I'm just saying, it hasn't changed much, has it?
So two, looks like maybe two more. Go ahead, yes.
Hold on, Mama.
People 10 years old, fifth grade, next year I'm going to middle school. And I just wanted to like add on to my brothers and people like equal. In school, some people are not, like nice to you. Like they'll just be rude to you and they really think they can get away with it, which is not okay. They want to be good to us, like I get it, because sometimes I will do it. Like I will be to people because I don't feel right. And to do that, it's when they need somebody to understand them. And sometimes, like other people just need somebody to talk to understand. And if you do talk to them, then you might even change the world or person and somebody in the future. And that's what really counts.
Right. Thank you very much. Huh? I know. And then Pat, and I'll wrap up.
Okay, just really quick. Hello everyone on the back of the room over here. My name is Sarah. I run the Contra Costa Budget Justice Coalition with my colleague Mariana, and I know Maisha for the past year. And of course, hearing everyone's story, and I think specifically around the Brookside Medical Center, I remember that was one of the first places where was really taken care of, and was kind of really put together a team to treat her sickle cell. And so that was something that I feel like my family always appreciated, and I feel like that center will always hold a really, really special just place in my heart. And yeah, I just wanted to share that.
And thanks, Sir's work really does advocate for an equitable budget. It's a whole coalition of diversity in your coalition to advocate for that. So you're all amazing, actually. I mean, you all are.
Well, again. So I say, excuse me, to each and every one of you that should be standing, thank you for choosing St. Peter, for making this difference in our community. And I want to say that once upon a time, a wise man said, history is his story. Once upon a time, when we had these thoughts, ideas, and feelings, and want to make a change, we came peace to the church. We didn't have a J.S. Belcher social hall. The church. My message right now is we to go to the church. We're hoping and praying. I know there are a lot of churches in this room. This will not be the only time you will come into this place with these issues. But I'm saying again, it is his story. Let's go back to the church. Thank you.
Thank you, Pat. And, you know, I was here Sunday when the church was celebrating its 72-year history, and really amazing things that came out of this church, the pastors of this church, not just you, but the team of folks from this church. And as I said earlier, we are fortunate to have so many great faiths and congregations in West County that have stepped up to be some homelessness, on healthcare access, on other social services, on discipline grants. And it really truly been a place for us in this county, and appreciate that. So this was really powerful.
Yeah.
So we didn't get it. That's why we didn't get how much time everybody got, right? Because, you know, often we get times to have this type of back and forth and discussion, and I'm glad we're doing enough town halls to be able to do this. And yes, we come back in the future. This is a start. So on process, to respond to the doctor's question, what we do is come out of these town halls is to come up with a type of solicitation document that goes out that sets parameters based on the public input. It's being said today, things I'm thinking about, so that there'll be an application for grants. 1,000 over 50,000. So we will follow that up in a very public way. Okay. And sure that I'm going to advocate what get used here.
John, tell them how much there is, $17 million countywide after that one.
Say something since I get that insurance opportunity. Yeah.
So glad to be the coolest. I've been to all the towns. This one right here is the coolest. I'm not joking. The rest of them, like someone standing by the podium, just like standing up. So I just want respect for coming out tonight. Anyway, so there's a $17 million that is in the county coffers that's available. But I strongly encourage you.
About $3 million per district if we have to divide it up.
This countywide, John.
That's what we do, right?
But 17, get the money, that 17 million. So it's just a start for this district, and y'all know exactly what you need is very powerful. Y'all got this. 17 million more. The board of supervisors is going to meet on October 21st. Put that on your calendar. You can come to Martinez, right? Come and lift up your voices. What I heard tonight was powerful and beautiful, and not enough. At the board of supervisors, John does an amazing job representing your communities. And he's on it. But the direct voices of all of y'all and folks who couldn't come tonight, that's the other gap. That's the other equity gap. We need to have voices. And others are just backs here, but that is the voice that is missing the board of supervisors. So I just want to invite you to welcome space. Yeah, right. Let's go. Exactly.
Thank you. I think that's yes. Yes.
You can dismiss us.
Right. So I do get the pastor to dismiss us. I will just say before I hand it over. This process. There's other town halls that people could participate in. Tell your friends with a flyer on it. It's in Allison Hall and it's provides us in Richmond. So it's to the left. Yes, I advocate for the other 70 to be part of this countywide allocation. That money got put into the reserves. We are lucky as a county. We have a lot of reserves. We're fiscally responsible. We can spend that 17 unspent federal dollars. I've been advocating for that. So having more voices there will help us. Please talk to your friends and other supervisorial districts because, you know, there's people that feel like you with the other districts. And I think it's really important for you to do that. So again, thank you, St. Peter CMP for your spiritual. The center for a lot of great discussions. Many of us have been lots of discussions about issues. So thank you, St. Peter, for opening. Pastor Jude to just close up. Welcome. I know we welcome you on Sunday. So something. I'll say something that we said back on Sunday. You know how we welcomed her. The earth shook. for that at 3 o'clock in the morning. Where was that? 3 o'clock in the morning, where it's shut to welcome you. You don't get that kind of stuff in Mississippi. You just get it here in California. So it was an announcement to the world that you were here.
Good evening. I've heard some great things tonight. I'm not really understanding a lot about your communities and all you guys are calling. But the thing I do understand is a childhood education. That was my thesis thing for ITC that I graduated with my MDiv. If we are not excited, I think preschools that education exposed before they get to kindergarten, losing the children. And that is what I'm tonight that touched my heart. If we do not advocate and excited, there's a pipeline that's building for present children. We don't get them the same playing field that others have, then the generation for tomorrow to be like us, look like us. Teach our children what it means to go forward and the funding to go forward. Thank you all for coming. You get it. How did I get the business? Okay. We thank you for the food. It was good. We thank you for taking it home. There's more food to take it home. So you were saying you're welcome to take it home as we get ready to dismiss. I think I'm in church. Y'all miss a crowd without being in church. Thank you all for being here. May God bless each and every one of us that tonight. We say in the scripture in James, be not the hearers, but do the word. Say go forward. Thank you.